Okay, we'll get started now. So good afternoon, everyone. My name's Lucy Salmon. I'm Professor of Palliative and End-of-Life Care at the University of Bristol, and I'm co-director of the Bristol Centre for Grief Research and Engagement, which launched earlier this year. This is the third in our online seminar series, run in collaboration with Good Grief Festival. And today's webinar will last an hour, and there will be time for questions at the end, so please add these to the Q&A box, which you can find in the bottom centre of the screen. I'm really delighted to welcome our speakers for today, Dr. Sabrina Bajwah and Dr. Catriona Mayland, who'll be speaking about the really important National Equitable Bereavement Care for All study. Dr. Bajwah is a clinical reader in the Department of Palliative Care, Policy and Rehabilitation at King's College London and an honorary palliative care consultant at King's College Hospital. Sabrina is the chief investigator on the Equitable Bereavement Care for All study, and her research interests include different models of palliative care and racial inequality. She's a passionate egalitarian and drives forward equality, diversity and inclusion in all aspects of her clinical and academic work. And Dr. Mayland is a senior clinical lecturer and an honorary consultant in palliative medicine at the University of Sheffield and Sheffield Teaching Hospitals NHS Trust. She's co-lead for one of the University of Sheffield's cancer strategy key themes, enhancing patient experience and voice. And she also leads the project group related to quality of care for dying people and bereavement support within the International Collaboration for Best Care of the Dying. And she's recently been awarded an NIHR Advanced Fellowship, which will focus on improving the evidence base for care in the last days of life and the methodology to enable more inclusivity. Sabrina and Catriona, it's really wonderful to have you here. Thank you for joining us. And I'll hand over to you to share your slides, Sabrina.
Thank you. We're delighted to be here, and I'm just going to hopefully share. Please let me know when you can see the slides.
That's fine.
Thank you. So, yes, we're absolutely delighted to be here today, and thank you for inviting us. And we're going to present today on our findings from the Equitable Bereavement Care for All study, which is aimed to assess the bereavement needs of ethnically diverse communities. So, Kat and I jointly lead this study, and for which Lucy is also a co-investigator. And today we're going to give you a bit of context around this study, and then also present and share key learnings from the first two work packages of this study. So why was this research needed? There's been long-standing inequities for ethnically diverse groups, i.e. those who are non-white British, and for many years these groups have been experiencing worse health outcomes. And really, COVID has worsened inequalities and inequities related to race for these groups. There's been a disproportionate impact and increase in deaths for people who were impacted by COVID. And more specifically, there has been aspects of structural racism within this system, specifically policy changes such as restricted visiting impacted and disproportionately impacted ethnically diverse groups during the COVID pandemic. And whilst bereavement is universal, access to support remains unequal and inequitable. So bereavement services currently within the UK are framed in a very white model of care and of grief, and currently reach fewer than 1 in 20 people from ethnically diverse communities. And when they do, they don't meet the needs of these communities. For me, I experienced this personally when my brother died unexpectedly in 2020. Our family were devastated, and I quickly recognised that we needed bereavement support, and specifically for the 3 generations of my family, which included my 8-year-old Pakistani mother who only speaks Urdu, and my brother's 3 young children who were all under 10 at the time. Despite being English speaking and literate, I hit a brick wall when trying to access cultural and religiously appropriate services for my family. And actually, this deeply personal experience really spurred me on to conduct this research alongside my equally passionate colleagues. So what was the aim of our study? So uh, our study aimed to, for the very first time, understand the bereavement experiences and bereavement needs of those people from ethnically diverse groups, and to start to begin to understand and identify solutions on how we could address shortfalls of current bereavement support service and address any unfairness or inequitable delivery of services. And really importantly, this study was founded on a conviction that equity begins not with identifying deficits within ethnically diverse communities, but recognizing and valuing their assets, their long-standing knowledge and compassion and resilience, and that already exists within them, and building on those. And from the outset, our aim was to shift the narrative away from seeing ethnically diverse communities as a problem that we need to fix or hard to reach, and towards understanding that exclusion arises from systems and structures, not from those communities themselves. So what did we do? So we had three work packages within our research, and I'll be focusing on the first two today. The aims across the work packages were really to explore awareness and accessibility and experiences of bereavement support services for people representing specifically ethnically diverse communities, and to investigate barriers and facilitators to improving accessibility, acceptability, and appropriateness of bereavement support services from the perspective both of bereaved people and service providers. And then also to understand good practice in how bereavement services advertise their services, adapt their services for diverse communities, and really widen access in a meaningful way. So we did this through three work packages, and the first two I'm going to present today, and the first of which is group discussions, focus groups, and individual interviews with bereaved people, and work package two, which was related to interviews with bereavement support services as well. The third work package involved developing detailed recommendations with key stakeholders, but we will be presenting some key findings which fed into those recommendations. We've also produced a short film from this research, and made those detailed recommendations for policy and practice. Work package one, we recruited bereaved individuals from ethnically diverse communities. We were given a very wide remit by NIHR to reach as many communities as possible, and eligible participants that we aimed to recruit would be adults aged greater than 18 years old who self-identified as belonging to an ethnically diverse group, so non-white British, and no exclusions were applied based on immigration status, English proficiency, literacy level, or digital access. And this was really to ensure that participation was not constrained by structural institutional barriers. Our recruitment aimed to work with community groups, and at the core of our recruitment strategies were community researchers. Our recruitment was nationally across England, and we recruited by social media and webinar outreach, and through our community researchers. In London, we had a particular focus on reaching the Black African, Black Caribbean, and South Asian communities. And in Sheffield, it was a South Asian, Somali, and Chinese, and in Luton, Polish, Pakistani, Bangladeshi, and Leicester, the South Asian community again. So we, in our NIHR-funded team, we have members from the Pakistani, Indian, African and Caribbean backgrounds. So this is us as academics and researchers. And to reinforce the diversity of our team, we actively highlighted our team's diversity on our website and within our social media platforms. By doing this, we aim to reassure our potential participants that the study was being conducted by people who were from these communities and who understood their cultural context and challenges. And we aim to foster a sense of trust and belonging from the outset. So not only were we a diverse research team, but we also keen to build trust and ensure equity of access through our community researchers. So our community researchers transformed our study from research done on communities to research that was carried out with and by communities. So we recruited 8 community researchers across 4 cities representing diverse ethnicities, a few of whom are shown here. And we had Bangladeshi, Indian, Pakistani, Chinese and Polish community researchers. And they really brought in-depth knowledge of their communities and spoke multiple languages, including Urdu, Punjabi, Cantonese, Mandarin and Polish. And also we had Adejoki, who was one of our NIHR-funded researchers who was deeply rooted within the Black African community and Pentecostal churches within South London and spoke 5 different African languages. So at the heart of our recruitment for Work Package 1 was the Respect, Trust and Equity model of recruitment, which we developed by us within the study team. And the aim of this model of recruitment was really to embed cultural safety, taking a anti-racist and trust-building approach to our recruitment, and actually focusing on an asset-based approach to all of our aspects of our recruitment. So this model emphasises how to operationalise respect, trust and equity. And this included the importance of using respectful language. For example, we didn't use stigmatising language like ethnic minority or minoritised, but and chose to use terms like ethnically diverse to celebrate these communities. But also the model operationalised equity of access as well. For example, we ensured that all of our outward facing material was easy read and pictorial and also translated as well. And where participants weren't able to read, our community researchers would help and go through the information sheets and consent forms with them. So the first thing that I think is important to communicate is our learning around Work Package 1. And the first of that is that we really have challenged the belief that ethnically diverse people are hard to recruit to research studies. So we had 120 participants take part in Work Package 1 and our target was actually 80. So we were 50% over our target and we could have recruited more, and we applied for a costed extension, but unfortunately that wasn't possible. So a really striking feature of the cohort that we recruited was the intersection of multiple dimensions of marginalisation. So we had 69% were first generation migrants and 55% had a first language other than English, and 38% had only primary or secondary education. And the really important thing is that these groups are often excluded from UK health research, where participation often requires high levels of health literacy, English fluency, and being familiar with institutional systems. So not only did we recruit high numbers of participants, but actually we recruited people who don't normally take part in studies within the UK. So we've and the end result is that we've actually recruited and conducted the largest and most comprehensive qualitative study within the UK, and also bereavement study. The ages of participants range from 21 to 80 years old, so there was a quite significant range, and the majority of our participants were female, and we would have liked to have seen more male. So we recruited from 13 different ethnic groups, and I think that's really important that that breadth was there. And here, this is just a diagram comparing the different ethnic groups to the UK census. So the blue bar shows our recruitment, and the orange bar shows what the census data for 2021 shows the UK population for that ethnicity. So compared with the UK census, we over recruited Bangladeshi, Pakistani, Chinese and Black African groups, which were substantially overrepresented, showing that they were keen to take part in the study. Indian, Black, Caribbean and Polish participants were proportionately represented, while Roma, Traveller and Arab participants were underrepresented. However, we did have a number of Roma and Arab participants that did come forward after the study was excluded. Sorry, I'd finished. Our recruited participants spoke multiple languages, and many interviews were conducted in their preferred language to ensure equity of access. And our recruits also represented a diverse range of religions and faiths, as illustrated here. I'm now going to hand over to Kat, who's going to present the results from work package 1.
Thanks, Sabrina. So I think the second piece of key learning is our findings really challenge some of the models of grief that have been very white-centric and Eurocentric. And the predominant way is that move from a very individual approach to viewing grief to actually think about that much more as a collective grief, much more as a racialized eco-social process that brings together a complexity of different factors. And I'm going to briefly talk through each of the 4 main themes from this part of our research, and then I'll go through them in detail. So I think firstly, you can see along the top the pervasive nature of racism, that participants shared lifelong experiences and that impacted onto death and bereavement. Culturally and community, family was very important, but there were some factors that could influence relating to expectations and roles that had an impact on time and space to grieve and to access support if that was required. Our studies also challenge the assumption that everybody has good informal support, and I'll talk a little bit more about the real positive impact from some of the informal support, but some of the less positive aspects as well. And finally, I'll speak about the participants who didn't naturally have a cultural network or community network for support, and talked about their experience of coping alone. Next slide, please. So participants shared the lifelong examples of racism and spoke about how these could be direct, as you can see in the first kind of quotation in the blue, but also could be more indirect and subtle, but these were equally damaging. For example, in a workplace, not having sufficient understanding about the importance of being able to attend a funeral that may not be an immediately direct relative. Racism influenced healthcare, both in the treatment of their family members, and that had an impact into the dying phase. The quote illustrates one person of one faith being sent a spiritual leader from a different faith, with that assumption being made and that having quite a significant emotional and upsetting impact. There were also examples of direct mistreatment and also experiences reported by our participants about how racism infiltrated and affected bereavement support services. These experiences eroded trust and made it very difficult and compounded the emotional trauma they were facing. Next slide. In terms of thinking about cultural influence and expectation, many participants expressed how the grief had affected them personally. But grief was more than just an individual experience, and participants also shared the collective impact that it had. By the death of somebody, not just affected that individual, but reflected a loss of cultural knowledge, affected a lot of the community who would normally give guidance and support through someone's grief. Some participants also spoke about the hidden grief, and for example, within Pakistani Muslim families, but also Chinese, also Black African, that sometimes the concept of grief was almost an unwritten rule that it should be hidden and gets buried. Next slide, please. This was compounded by certain stigmas that particularly related to mental health, and how again that this was not openly discussed or spoken about, and how that impacted on individuals' grief. Participants also shared the additional responsibilities that they may be expected to take on within the family. And one example of this was for the eldest child, who would often be expected to step up if a parent had died. While this was a real mark of respect, an opportunity to give something back and a real honour, there was situations where actually it could be rather overwhelming and meant that participants sometimes reported they didn't have the time and space to be able to process their own grief in the manner that they wanted. Next slide, please. The third theme related to the duality of informal support. Many participants spoke about the immediate support provided by their family and how beneficial this was. But they also spoke more widely of informal support and the real positive aspects about this, but also some of the challenges. One means of informal support was by faith and religious networks. Faith could provide real meaning and real structure and connection through rituals and practices that help people make sense and brought understanding to difficult situations. However, for some participants, they also talked about the judgment that was shared, and that actually the death had occurred in part but it reflected their lack of practice in terms of and dedication to their own faith. Next slide, please. The other means of informal support was provided by the wider community. Again, there were real positives that came from this support. People brought food, did shopping, and also provided guidance on practical matters such as organising a funeral, but also just generally giving emotional support and standing with the others. However, for some, and particularly practice where wide communities come to show respect, some participants reported that this felt like it came from obligation rather than meaningful support, and again had an impact on the time and space for those people to grieve. Next slide, please. And finally, the fourth theme that came from the bereaved individuals was about the impact of coping alone. So some participants, particularly from the Arab community, particularly from the Chinese, spoke about having to manage their grief privately. This was influenced by factors such as migration which meant that they didn't naturally have a community or cultural sort of support that was appropriate for their needs. This resulted in real loneliness and marginalisation from not being part of the dominant culture, and grief was even more isolating and difficult for these individuals. Next slide, please. The third piece of key learning relates to the meaningful inclusion really takes commitment, investment and honesty. And often you have to be invested both in time to make a real difference in terms of being inclusive. Next slide, please. This finding came from the second work packages, which involved our engagement with bereavement support services. These services were selected because they had made efforts to improve access and be more inclusive to their local populations. And the research involved conducting interviews with key members of people who worked directly at the services or were making referrals into the service, as well as looking at documents that supported the service in terms of leaflets and information sheets. 23 participants were interviewed from 12 services. Next slide, please. And this slide is just to highlight the different types of organisations that were involved. And you can see that it was both for child and baby loss as well as adult. And they ranged from small grassroots organisations, online kind of forums and support groups, to national organisations. Next slide, please. In terms of their learning from these interviews, the first was about organisational workforce and the culture. And actually, if there was to be meaningful engagement, a commitment to equity, diversity and inclusion was needed across the whole organisation and at all different levels. It also involved critical reflection about current practice and what was needed to really improve and change culture and workforce. The importance of having diversity in both the staff employed and volunteers supporting services was equally important. But participants encouraged people to be mindful of the additional burden and labour that could be placed on certain individuals. And this participant talks about them, being expected to fly the EDI flag, as well as providing, the support and care that was needed. Next slide, please. Again, the active and open acknowledgement of racism was really a key prerequisite to providing appropriate support. It was important to kind of call racism and discrimination for what it was and to call it out and to be mindful and active in terms of addressing that, or else basically it wasn't going to work. Next slide. Equity was also really important in terms of thinking beyond a one sort of size fits all and actually beyond a person-centred support to really tailor care and support to individual needs, considering intersecting characteristics, different cultures, faiths and practices. And I think the quotations sort of shared are about sort of thinking about how you actually engaged, and that it had to be not just a once-off, but a continuous and meaningful way of engaging and working together, that you build trust over time. Next slide, please. And finally, the fourth key aspect that contributed to meaningful inclusion was looking at the funding and organisational capacity. Many sort of smaller organisations focused on some of the issues that they've been facing about the inequities in terms of the funding systems and the impact on the capacity that they were able to bring. Next slide, please. I'm not going to go through this in detail, but this was sort of just to highlight the long list of recommendations that came forward from the two work packages in terms of thinking about bereavement support services and what was needed in terms of accessibility, acceptability and appropriateness. And these were a starting block to feed into the subsequent recommendations that have been developed. Next slide, please. And this long list was brought together in the third work package, which consisted of co-design workshops, which we partnered with key stakeholders. And the photos here just illustrate our final kind of celebratory event that we had in London when we had worked together with for the recommendations. And also that the feedback was used to revise and produce the short film. Next slide, please. And I'll hand back to Sabrina.
Thank you, Kat. And I think today, really, what we want to do is kind of send some key messages home with you from our findings from work package 1 and 2. And really, I think they are around racism and around making assumptions and also around adapting support depending on need. So I think that every day, I think that each of us should be adopting an anti-racist stance. I think it's incredibly important from our data from work package 1 that participants feel that it's incredibly important to acknowledge discrimination and address racism. And whilst we're not able to fix all the racism that people experience, what we can do is ensure that racism is acknowledged and that experience of racism is acknowledged when we come into contact with people who have been bereaved. And that's a recognition of both personal racism and racism they may have experienced as related to structures and institutions. And it's incredibly important in thinking about building trust. And we found that in terms of our recruitment and also from our findings of work package 1 as well. So I think the other thing that came out really strongly from work package 1 was really don't assume things about people just by looking at them and from what their ethnicity is as well. I think there is an assumption that, as Kat was saying, that people are getting support from their communities. However, I think that's an unfair assumption to make, and actually we should be checking with people individually on what support they may need in addition. And also, I think there is a tendency to assume that Western models of bereavement are applicable to these groups. And one of the things that we have developed as a result of this work from work package 1 is a new conceptual model of experience of grief for these ethnically diverse groups within the Western setting, and we're hoping to publish that soon. And really importantly, it's not okay to use a one-size-fits-all model of care, and I know that I've experienced that personally, and actually we need to be adapting the bereavement support that we deliver for these communities, but we shouldn't go in with a paternalistic attitude that we are there to fix them, and we should build on assets already there within communities, and that takes networking with faith groups and community leaders, and only through that can we perhaps in the future address stigmas as well within these communities. Some of the things that came through really strongly, as Kat has described, is that sometimes grief isn't talked about in different communities, and I know that there isn't a word for it in Urdu, and there isn't a word for depression either, and it's really important that we cross those barriers. And it's really important that we let people know where equitable services might be as well. So one of the things, and the quote there illustrates it beautifully, is that a lot of these communities don't know about these services, and that's actually our fault. That's our fault, because we haven't reached these communities and communicated appropriately as to where these services are. And that's an area that I think we need to work on in the future. So what we're hoping to do next is that on December the 4th, we have going to present the findings from Work Package 3. So bringing together the findings from Work Package 1 and 2, and then presenting how we did the code design and the final recommendations. And they are detailed recommendations on how to deliver equitable care and bereavement care for ethnically diverse communities within a Western healthcare setting. And they are applicable for really everybody who comes into contact with bereaved individuals in everyday, and actually for those who have experienced grief as well. So please do register for the event, and during that event we will also pre-event circulate the link to the film that we've developed, which summarises the research and summarises all the recommendations, and then we will be having a panel discussion. So please do join us for that event, and hopefully a link has gone into the chat. Please do email myself or Kat if you want any further information, and those are our socials. And we have a page at King's College London as well, which promotes and has information on the study. So I do finally just want to thank all the bereaved individuals who took part in our study, and all the community organisations and faith leaders who shared all their time, experience and expertise. And our research wouldn't have been possible or successful without our community researchers, and I think their commitment and their investment in this study made it possible. So and this study is a testament to the strength of our participants and our community researchers, and they've all spoken of the faith of family and the solidarity of the organisations who took part tirelessly in this study. And to date, many of these small grassroots organisations continue to work with very little sustained funding to support other people through loss. And then I think everybody working in this space and their contributions reminds us that equitable bereavement care must be co-designed by those communities and not designed for them. So these communities have shaped every aspect of our study, and their courage in speaking out about such sensitive and emotive topics, and topics which have really left them very vulnerable, and we are very grateful to that. And now it's our collective responsibility as those who work in bereavement care to ensure that bereavement care becomes more equitable, and it's grounded in anti-racism and informed by lived experience and built on the strengths of these communities. And this is just an acknowledgement to the funders and those who did the research. Thank you.
Thank you so much, Sabrina and Catriona. It was a very clear presentation of a really impressive study, so thanks very much. We have a few questions, so we'll move to those now. We're getting some clapping images popping up on the screen. The first question, which I think is from C. Bowman, can you tell us more about the new conceptual model of grief being developed?
Yes, so this will feature as a forthcoming publication. I think at the heart, it's, as I said, it's a move away from this like very individual view of grief. If you think about dual process, where an individual moves between grief-related activities and then restorative activities, it's very much focused on the one person. Even with continuing bonds, it's between that individual and the person that's died. But actually what we saw is it's a much more complex interplay of factors. And in the new model of grief, one of the key things is at the centre is not just the individual and the individual grief, but the collective grief and also the racism, because racism pervaded throughout people's life. And actually for the people who shared and participated, and you can't take that away of having such a central influence. And that's not really been seen in any other model of bereavement that I'm aware of. So I'd say that's the key thing. And then thinking about almost the factors of influence around that kind of individual collective racism in terms of, communities, organisations, environmental factors, politics, sort of structural issues that also have an interplay. And that's what hopefully the new model will demonstrate.
Great. Thank you, Catriona. I'm really looking forward to seeing the final version of that. Another question here from Anna. Were there parts of Western bereavement support that were identified as particularly unhelpful or disconnecting for the participants? I mean, I know you already mentioned when you were presenting the sort of lack of acknowledgement of discrimination, racism. And I remember there was one participant quote where someone had been told that actually they weren't allowed to talk about that aspect of their experience within the bereavement counselling setting. But are there any other aspects of, I guess, mainstream bereavement support that were flagged as being particularly unhelpful or, not in line with what clients actually wanted?
Should I start with that? I think it's really important to just say that the dismissing of the experience of racism, I think, was really important, because it made people from the offset lose trust in bereavement services, and they talked about how they didn't want to then speak about their bereavement and show their vulnerable side when they'd been dismissed in such a way. And I think that we can't underplay how important actually acknowledging and adopting an anti-racism stance is. Then also, I think not having equity of access in terms of bereavement services was incredibly important as well. So I think some services did have interpreters available, but they were only available on certain days. So that was limiting access to bereavement. And I think the danger is bereavement services. And then I think the danger is it almost looks like a tick box if there isn't the same level of service delivery as well, and services begin to look disingenuous as well.
I'd maybe add to that as well, just what Sabrina sort of touched on in the presentation about the assumptions, and particularly that assumption that everybody has a language for grief and bereavement, and that's not the case. Sometimes it's not direct translations, and actually that was one of the key learnings in terms of myself working with the community researchers within focus groups, was actually people sometimes don't have a language to know that to describe grief, and actually talking in a different way about loss or using language through the community researchers that resonates and has meaning was really important. And I think sort of the services that I've certainly been part of or worked with, there's certain assumptions that are made that everybody will understand, and that's not the case. And I think we need to kind of reevaluate and rethink about that.
That whole kind of psychological perspective of grief as a journey that an individual goes on and gets from one place to another place is really undermined by the findings from this study, I think. Another question here, more on the methods. So this is an insightful work, looking forward to reading the articles. I wanted to know how the co-design sessions were managed. How did you ensure that the members were listened to and genuinely involved in the design? I'm asking because we're also looking at designing a suicide postvention training with the Muslim community, and knowing your experiences and recommendations would be invaluable. So the co-design sessions and ensuring kind of equity and listening to the members involved in that.
Yeah, I think it is hard, and I think that we did try to follow experience-based co-design methods as closely as possible, and we had a number of individuals who didn't speak who didn't have English as their first language, and we ensured that they were supported with interpreters within the process. We tried to make sure that we could have smaller group work where possible, to hear the voices of those individuals who might not feel comfortable to speak up in a certain setting, and we tried to as well to reach out after sessions to individuals as well, to see if there was anything specifically that they wanted to add, and give them the opportunity that way.
Yeah, thanks, Sabrina.
I might just also add that I think trying to kind of demonstrate how we've taken on board comments and listened, and how that's actually changed some of the things we did. So, for example, initially racism wasn't the first aspect we presented, and actually on those further discussions, actually that is the thing that's almost the most important. So we had to, you know, reflect and put that as really the top priority. And if it's, you know, one thing to really take away, that would be it. And I guess, yeah, taking on board advice when we shared the initial part of the film and aspects of that about how they could be improved. And that led to sort of refilming some aspects to try to, you know, actually demonstrate in a tangible way that we were, you know, serious about taking on board what people said and thought.
Thank you. And then another one here from Samuel Bartlett. Were you able to interview individuals from different generations in single families? If so, were there any findings regarding how different generations experience grief, and also in their capacity to access services?
Will I go first?
Yeah.
I mean, that would have been possible. To my recollection, Sabrina, correct me otherwise, I don't think we did have people from the same family taking part, but I think it was clear from what participants said that actually needs for different members of the family were very different. And one particular example I can give was the participant was the daughter, and she spoke about her own needs and her mum's need after her dad had died. And one of the concerns was actually a lot of the bereavement support was being directed to her mum, and her mum didn't necessarily feel she did need that, but actually there was a daughter in need there who was kind of just almost ignored, and her needs weren't initially recognised. And so I think there is that, you know, when we've talked about that tailored, that really thinking about, you know, what is needed for this kind of family, it's trying to be flexible and adaptive to kind of not just think of that immediate who's listed as next of kin, but think a little bit wider and include that in part of your questioning. Are there other important people who may need support in this situation?
Did you want to add to that, Sabrina?
No, I think that's everything.
Okay, thank you. I've got a question. It's really about the key learning from a kind of academic perspective in terms of doing research in this area. You obviously presented the model that you used to inform recruitment, and that resulted in such successful recruitment. But I wondered from a research perspective if there was anything else that you learned yourselves through doing this work that will inform your future work, or anything that you think would be helpful to perhaps more junior researchers working in this field, coming into the field of bereavement, but also thinking about equity from the start as well.
I think for me, it's about showing people that you are trying to recruit that you understand them, and that you care about them. I think that is the most important thing that I've learned. And I think I didn't quite expect this to happen, but when I shared a post around my brother's death and the fact that we were recruiting to this study, it got 80,000 impressions on it was Twitter at the time, and we had 25 people send emails saying that they wanted to be part of the study, and I think I think feedback has been that actually opening up and showing that I had a similar experience myself. That was the motivation. Developed trust in the sense that people thought, well, actually, we're going to take part in this study, and the team care about what actually happens and the outcomes from this as well. So I think it's really about connecting with the people that you are trying to recruit, and actually showing them that you care about them. I think that when you have been in a community where for many years you've experienced racism and inequality and inequity through many parts of your life and throughout your life from different institutions, then why would you want to take part in research otherwise? And it's our job to show people why they should.
Yes, Catriona.
From my perspective, what was kind of key learning for me was, I guess, working with a community researcher and having a real partnership there. And actually, so Noreen, who was sort of one of the community researchers on screen, I guess I learned so much from her. So Noreen is sort of equity and quality lead within a hospice, but actually she's also a Muslim scholar. And I think her ability to be able to provide reassurance, to kind of explain actually both to, people who are participating, but also to myself and other members of the research team that we were working with, what does, in terms of a faith perspective, what do we know? What does this say? And I think there's just a lot of lessons from her that I personally would take on board. And I think that second point of key learning was, I think we were fairly quite a reflective team, and we so Sabrina spoke about the terms and the language that we used, and actually being quite self-critical and kind of really thinking about these things that I think sometimes can get a little bit dismissed, and actually it's really important. So those would be my two things: the work with the community researchers and our reflective nature and thinking about language.
Thank you both. We're going to do the next two questions very quickly, so let's do nice, concise answers. So one is from Deborah Clark. She said, I know my colleagues have had problems using translators as they haven't always translated what the colleague wanted to communicate. Have you had any difficulties with translators during your study? And the people who are part of the study have also found difficulties. So around working with translators and interpreters.
So we had a budget for translators and interpreters, but actually we didn't need it because we had our community researchers, and our community researchers, whilst recruited from the communities, underwent a 5-day course to actually train them in qualitative research and to understand the importance of actually ensuring that there is validity in recording everything, and so they actually conducted the qualitative interviews for us in all the different languages, so we didn't actually need to use translators and interpreters. So and I think actually having them come as Kat said, already embedded within the communities, they were trusted individuals. I think the problem with translators and interpreters coming in is that it's often seen as somebody else coming in and may not be a trusted individual.
And actually, in lots of contexts, I think the interpreters or translators need support and understanding and knowledge themselves in order to play that role, don't they? And I think sometimes maybe in healthcare settings they're not necessarily given that training and support that they might need around communicating about something like bereavement or end-of-life issues. So an important point. And then the final question that we'll take, do you have any advice for recruiting a more diverse range of volunteers?
In terms of, I think that if we're talking about, are we talking about community researchers or are we talking about participants?
I imagine it could be volunteers at a bereavement service.
Ah, okay, yes. I think I would say trying to communicate that it's not a tick box exercise. I think that trying to get across that you do care about wanting to change the care that you deliver for these communities, that you understand the issues that these communities experience, and that you will value those diverse volunteers that come into your organisation, and you will support them adequately as well. I think individuals might feel scared or worried about coming into an organisation and being the only ethnically diverse individual, and I think it's really important that those individuals are celebrated within the organisations that they come and work for.
Thank you, Sabrina. We will end there. Thank you all so much for such great questions and for coming along today. Please do go to the events page on the Bristol Centre for Grief Research and Engagement webpage to find out about our future events. The next one coming up is on the art of grief, creativity, loss and the imagination with Liesl Dawson on the 15th of January. Please also do look at the registration page for our launch event for the short film about the Equitable Bereavement Care study, when Sabrina and Catriona will be joining us again. Really looking forward to that. And just a huge thank you to you, Catriona and Sabrina, for coming along and telling us about this really important work. So thank you, everybody, and goodbye.